rolling. 3, 2, 1.
Hello and welcome to another episode of Glamour with Katrina. Well, today I'm honoured to have the famous Dr. Maria Khattar with us, International Director of the A4M Academy, where she trains other doctors on many different modalities to do with injectables, laser therapy, and so on. So I would like to introduce her and get her to tell us a little bit about herself and her background. Thank you, Dr. Maria, for coming. I am truly honoured.
It's my pleasure, Katrina. I've known you so long. I've been in aesthetic medicine for over 20 years, and it started way back in 2002, actually, when there wasn't much in that regard in Dubai. And it was basically aesthetic medicine was more or less in its inception. If you consider the beginning was in 92, which is when Botox was discovered. So by 2002, we began to see a lot of developments. So that's when I first opened the first clinic. We ended up with 4 clinics in Dubai, an aesthetic medicine trading company distributing lasers and devices, injectables, etc. And then I started the training institute to house the American Academy of Anti-Aging Medicine. We were entrusted in teaching the aesthetics course outside the USA. So we're the only center outside the USA which have been accredited and given that task. So of course, I have a real passion for what I do. I don't consider it a job at all. It's really a
We
hobby.
know this about you. We know this about you for sure.
It's a hobby, especially with so many developments over the last years, especially in the devices, the lasers, the energy-based devices that truly can transform the skin.
Yes.
Now, as we discussed, we're living in a new era, which is the era of what we call the rapid weight loss patient.
Yes.
And all that incurs in terms of changes in the face and body. And why that happens. And this is, I think, what
we're going to talk about the new drug that everybody's raving about, the GLP-1, better known as Ozempic or Mounjaro. So can you tell us a little bit about it and how it helps women that want to lose weight?
Yeah, basically it's a group of drugs known as the GLP-1, and some of them are also GIP agonists. They stimulate certain receptors. The way they work is basically they have an effect on the brain. They give you a feeling of satiety. You feel full, you don't feel hunger. Plus, they delay gastric emptying, so the food remains in transit longer, if you know what I mean.
Okay.
And they are a game changer. Now we are living a totally new era because so many people are availing of these. Initially, they were developed to treat diabetes because they control blood sugar, they control insulin levels. So they have a multitude of health benefits in the cardiovascular system. They help in cognitive function. You would be surprised. They help to combat other addictions apart from food addiction, even alcoholism. So now, of course, some of them, like Mounjaro, have been also approved for weight loss. And they are being used by weight loss patients. I believe even some people are availing of these medications as microdosing. I mean, basically, they are being compounded in much lower than therapeutic doses because these people don't really need to lose weight, but they want to avail of the benefits of these GLP-1 agonists.
Yes.
So they have many benefits.
I mean, when it first came out, I knew a lot of girls that went on it. And, I was hearing about horrendous side effects, a lot of sickness, nausea, headaches. And, you'd see a girl one month and then the next month she'd be super skinny, like overnight she'd lost all this weight. I mean, what are the dangers of misuse?
I think the most important thing is for the patient to be properly followed up. There should be constant monitoring in terms of blood testing, in terms of when and if the dose should be increased, because what tends to happen is people immediately jump to the higher dose. Let's say, for example, Mounjaro. The initial dose is 2.5 milligrams. So if you're on it for a month, so you have a dose every week, so you have 4 doses for 1 month, people are being automatically put on the higher dose, even though their appetite is being controlled. So there's no reason. I mean, it's better to lose the weight slowly and gradually rather than to increase the dose and suddenly lose a massive amount of weight with all that has in terms of effects on the body, on the skin and on the face. That's the main problem. In terms of the side effects, yes, definitely if the dose is high, nausea because of that's one of the gastrointestinal side effects. But there are no really disturbing side effects with these drugs. I mean, a lot has been talked about in terms of the effect on the thyroid. But if you monitor thyroid function regularly, and the incidence is extremely rare, almost negligible. So there are no really detrimental side effects, I can say.
Okay.
Yeah.
So what happens in terms of nutrition if someone isn't hungry and they're not eating much? How does that affect their diet and nutrition?
The monitoring again comes in.
Okay.
So if you are, let's say, on the minimal dose, and it has been known that people were able to lose almost 50 kilos in 1 year on the minimum baseline dose of Manjaro, which is 2.5. Slowly and surely, you will have more control. You have to have protein intake because one of the potential side effects could be loss of muscle mass.
Oh,
So
okay.
exercise is very important. Building muscle is very important through proper nutrition, supplementation, all of these things. So yes, but when you have more control mentally on what you're eating, then the likelihood is that you will be able to institute these proper nutritional and lifestyle habits.
Yeah.
You know, it makes the journey much easier. So if you supplement with, even if you can't eat protein, let's say you're vegetarian, let's say protein shakes and the likes.
Obviously, with quick weight loss comes sagging in the face, in the body, especially for people that are more overweight. What kind of devices can you recommend that they use, or what would help them?
Okay.
If they came into your clinic, say,
Yes.
what kind of protocol would you advise?
I think initially we need to distinguish with people who lose a massive amount of weight in a very short time. It's not only the percentage body weight loss, but the rate of weight loss that counts. Okay, this is what makes the difference in terms of the physical manifestations such as laxity, dull skin, loss of volume, all of these things. For example, let's say people who lose a lot of weight after bariatric surgery typically need to go for surgical
Removal
removal of skin. They need a facelift or body lift. But with the weight loss medication, if the weight loss is gradual and controlled, yes, there will be some effect because our adipose tissue is a source of stem cells. And our stem cells release hormones and cytokines, which are very important for regeneration of the skin, especially some of the adipose tissue in the dermis, which we call dermal white adipose tissue, is responsible also for this regeneration. So when you lose that, of course, you're losing the regenerative properties of the skin. So this is where regenerative aesthetics comes in. So you need to institute treatments, devices that are evidence-based to stimulate all of the collagen, elastin, what we call the glucosaminoglycans, our natural hyaluronic acid in the skin. And there are a multitude of these methods.
What are your top 3 favorite ones?
We have been following up on these weight loss patients on medication. And what we advise is to start at the very beginning. So we start with hopefully some prophylaxis, prevention, and correction as and when needed. So typically we would see them, for example, monthly just for their body composition analysis. So this is very important. You have to check them, see how much fat they've lost, how much visceral fat they've lost, what's their BMI, that's another thing, and the muscle mass. But also we check them in terms of their skin, their facial shape, their contours. So initially we start with the top one for us is polyallactic acid. Polyallactic acid has been proven relatively recently this year to be one of the most powerful biostimulants we have.
Which another word for that is? Sculptra.
All the studies have been done on Sculptra.
Okay.
You know, recently there's been a huge interest in biostimulation.
Mm-hmm.
And there was a comparison done in this study of the American Academy of Dermatology, JAD, which is one of the foremost journals in our field, whereby they injected Sculptra in the nasolabial folds, on one nasolabial fold of volunteers, and they injected another biostimulant. I won't name the name, another very popular one. And then they looked at something very interesting, which is gene expression. What genes you express. You know, we can modify a lot of things by modifying gene expression, right? Generally.
Okay. Can you explain that a bit more to our audience?
Gene expression?
Yes.
Basically, you know, for example, if you are when you're born, you're born with a deck of cards, let's say, in terms of your gene,
Sure.
your heritage. Let's say you are prone to have diabetes, but if you have a proper lifestyle, you can alter gene expression, so you won't develop the condition. This is what I mean.
Correct. Okay.
So they looked at gene expression with Sculptra compared, I will say it, calcium hydroxyl apatite, the other biostimulant, okay, which is very popular. What they found is that the Sculptra expressed genes that coded not only for collagen, but for elastin. And elastin can only be formed in environment of low toxicity and low inflammation. Okay.
Okay.
And they also found gene expression for skin thickness, for the other glucosaminoglycans, and also for pigmentation, so controlling pigmentation. So there were many, and antioxidation.
And
So
Sculptra can do all of that.
that.
I
It's
did
the
not know
only
that.
proven biostimulant to do all of that, in comparison with calcium hydroxyl apatite, which coded for what we call pro-inflammatory cytokines. Cytokines are, substances in our body that code for things or signals in our body.
Yeah.
So calcium hydroxyl apatite, on the contrary, coded for pro-inflammatory cytokines, and maybe for 1/3 of the amount of collagen that did Sculptra.
Amazing. There's a bit of controversy over Sculptra. They're saying in Europe that they're not using it anymore because it's got side effects of this and that. Yeah, I've heard that from several different people. And I always recite what you say about it because I know that you do your research. So, because a lot of people are confused about how Sculptra is different from a filler.
Yes.
A hyaluronic filler.
Okay, Sculptra, if you imagine a vial of Sculptra, contains little crystals of something called polylactic acid, which do not dissolve in water. Okay, so these tiny crystals, we suspend them in water. So imagine like a teaspoon of white sand, which you then suspend in water and then you inject in the face. Now, how you inject, where you inject will determine the final outcome. So basically, if you want only skin firming, you would inject the whole lateral face and you would do like a pan-facial distribution of these crystals everywhere and allow the body then start regenerating itself by making all of these proteins in the skin. However, if you wanted to create volume, you could definitely do that by injecting more of the suspension in certain areas of the face. So there are two ways in using Sculptra. And this is where the person injecting is extremely crucial, because if you inject too much of the substance in somebody who doesn't need volume in that area of their face, say, for example, in a woman, the submalar area, this area, we know that this in a woman has to be slim. So if you keep repeatedly injecting this area and suddenly you wake up with excess volume in the submalar area, there's no way you can dissolve it because this is now the patient's own soft tissue. You have created soft tissue. It's not like a filler that you can then dissolve.
Yes, and this is the big difference.
This is the thing.
You cannot dissolve it.
You cannot dissolve it because you are going to dissolve the biological effect, which you cannot do of Sculptra.
Obviously, there's a weight to that, so it doesn't pull down the face in any way, like long term.
You mean the weight, the weighting
Like, you
gain?
know, a lot of people say if you put filler in the lower face, it
Yes.
sometimes starts to drop over
migrates.
time, migrates, and all the rest of
Yeah.
it. Sculpture is something very different.
Totally
correct?
different. Totally different.
Are there any danger apart from that?
The only, like any injectable which has substance, whether it's a gel or particle or whatever, if, let's say by mistake, you've injected into an artery or blood vessel, you can have blockage of the blood vessel. This is common, but the possibility with Sculptra being such a dilute suspension is 70% less than with a filler. That's one thing. The only possible effect is if, for example, you inject too much in one place, or if the patient doesn't follow the instructions of massaging the face properly for 5 days subsequently to distribute the particles, you can have clumping of the particles and you can get like a lentil size little nodule, which is a collagen nodule. It's nothing untoward. It's not a granuloma. It's nothing, dangerous, which luckily now we can dissolve should that happen with collagenase enzyme.
Okay.
So we have basically the antidote.
Right.
So honestly, the only thing is it has to be injected properly.
Right.
And there has to be a proper strategy.
Yes, and I believe you massage 5 times a day for 5 days after the treatment.
Right.
Okay.
Right.
Going back to Ozempic, Manjaro, I've seen people that have been on it for 2 or 3 months, they've come off it, they've gained weight again.
Yes.
What do you say about that?
Definitely that can happen. There is if they haven't learned how to modify their lifestyle, of course, that's an eventuality, but there is no reason why they should come off it.
Oh, really?
No, there are people on it for many years.
What would you say about somebody like me that wanted my optimum health, optimum, weight or whatever, who's not really overweight, but I could always do with losing, a couple of kilos here or there? Would it benefit somebody like me?
If you were desperate, you could, but I think for somebody like you, it's best just to modify your diet a little bit.
And do it that way.
Yeah, and do it that way.
So the idea of going on these kind of drugs is to re-educate yourself through the diet.
True.
Because obviously most people that are overweight are not eating correctly. They may be drinking too much. They're eating the wrong types of food. So you think that if they manage their diet, they change the way they eat, they come off it, they've got a better chance to sustain that.
True. They have developed healthy habits. They would have developed healthy habits, yes.
Any contraindications? Is there any person that would not be suitable for this drug?
I honestly, unless somebody's had thyroid cancer or something probably, but I can't think offhand. No.
And is there any diet that you would suggest that is better, one's better than the other?
Protein rich.
Yeah.
Protein rich, yes.
I find for me, I've always had problems with inflammation. And then I went on the keto diet, which I was very opposed to because of all the fat. And a lot of my friends were going on it and saying how fantastic it was, how well they felt. So I thought, let me try it. It worked so well for me. But I'm also an O blood type, O positive, which is high protein meat. But I now tend to eat a lot of meat, eggs. I've always had fish, chicken, and that works very well for me. Avocado, not so much veg, fruits, no. And I think as a menopausal woman, that is definitely the way forward.
Yes. Definitely.
What about insurance for this drug? Is it something that you prescribe? Do you prescribe?
Yes, we do prescribe.
You
Manjaro,
do?
Yes. Insurance, unless you're diabetic, it wouldn't be covered by insurance for weight loss. And the thing is, in our region, you can buy it without prescription from the pharmacy.
I was going to ask, yes, I'm aware of that.
I mean,
They
people
say
are
it's
just.
running off the shelves.
It was because the neighboring countries hadn't had it registered. I mean,
Right.
hadn't had these drugs registered. So people were coming to Dubai and buying it from Saudi, from Kuwait, and so on. But that situation has resolved. And now there is abundant availability in the pharmacies.
I was going to ask you something else. What was it? What's the difference between Ozempic and Manjaro?
It's just a different drug, a different formulation. Manjaro works on an additional receptor to Ozempic. And I mean, this is anecdotal, but I take it from people who've tried both that the initial side effects are less with Manjaro. It's better tolerated.
Ah, yes, that's what I've heard.
Yeah.
So who would be your typical person for Ozempic and who would be a typical person for Manjaro?
Honestly, we don't prescribe Ozempic.
Oh, you don't?
No, we just prescribe Manjaro.
And why is that?
And no, basically, we started off with the weight loss patients. We don't treat diabetic patients in an aesthetic practice. We're more comfortable. We're more, au fait with Manjaro. So we know how to deal with it. We deal with the side effects and everything.
And is there anything that happens? How does it affect sleep or anything like that?
No, I believe it's even being used to treat sleep apnea.
Oh, okay. So it is a relatively new drug in the terms of weight loss. I mean, I think it's been used for many years with diabetics.
Yeah, but weight loss, it's new.
It's
Yes.
new. So you're still kind of researching and finding out new things about it.
True.
So you would say then, in essence, it is quite safe to use.
Yes.
As long as you're guided by your doctor.
Correct.
And stick to the protocol.
True.
Because I think, in Dubai, that weight loss is such a multi-million-dollar business. And women want a quick fix. They want the quickest way to the end result that they can possibly find. And I think this is where the problems come in.
Yes. Also, women are also worried about their aesthetic and sagging, for one thing.
Yes.
So with the rapid weight loss, the possibility of excessive laxity is greater in terms of the speed of weight loss, especially for postmenopausal women.
Yeah.
So especially if postmenopausal women have not been hormonally balanced, let's say they have not availed of bioidentical hormone damage on the physique is even compounded by that. Right. So it's the weight loss plus menopause, and this is where they need proper counseling, probably referral to somebody who can put them on bioidentical hormone replacement, although there is an inherent fear in this region regarding that, but still it's our duty to advise.
Yeah, bioidentical, I've always been on that myself. How does it differ from HRT?
It's totally different. First of all, bioidentical hormones are atom for atom exactly as the hormones you had before menopause. So they're exactly the same composition, the same compounds. And typically, let's say the estrogens, you cannot take orally, which you would. The HRT was oral estrogen, equine estrogen. These are typically gels or creams which you apply, and they are absorbed transdermally. Progesterone also is natural progesterone. Testosterone as well in women also is sometimes necessary. Bioidentical hormones can literally be life-changing, and they're an integral part of anti-aging. I don't think there is, no matter how good you are with your diet, how much you exercise, and all the preventative lifestyle changes you make, if you do not balance your hormones, you will never optimize your health and well-being.
I had a personal trainer on here who had studied anti-aging with menopause to do with diet and exercise. And she was only 48 and she'd went through menopause. And so she did a 3-month program where she did diet and exercise without hormones. And it actually did work very well for her. And I did it. She took 5 of us and we all did it as a research.
Nice.
But I still didn't stop taking my hormones.
No.
And I think, I'm 58, she's 48. There's a big difference. not menopause. I didn't go through menopause till I was 55. I was very lucky. But I think as a 48-year-old, you cannot compare yourself to a woman that's in her mid-50s, 60s.
No, and then how is she assessing? Is she doing blood levels?
Yeah,
Is
she
she
was.
doing-
She
and-
was. She was doing blood levels. I mean, I didn't test my blood levels but I didn't stop taking my hormones.
No,
I mean, yeah.
you cannot. I mean, let's say you believe that exercise can increase testosterone levels, for example.
But it has to be heavyweight training.
Yeah.
Women have to do the heavyweights in order to stimulate the estradiol again in the body. But I think it takes a lot of discipline to do that, and you have to do it in the right way.
There is no harm. There's so many benefits of bioidentical hormone replacement.
Yeah. What would you say? I mean, let's break it down. Estrogen, because there's 2 or 3 different kinds of estrogen. Can you break it down for us so that we understand?
Estradiol, estriol, and estrone. Estradiol is the main one, which has the beneficial effects, and we have receptors. Actually, we have receptors for estrogens in many, many organs of the body, including the skin and the brain and so on, cardiovascular system. Estrone is the one that's potentially been linked to breast cancer, I think. So people are compounding estradiol and estriol, or many people avail of pharmaceutical grade, which you buy from pharmaceutical companies manufacture estradiol, certain percentages, which you can buy from a pharmacy. And many people, honestly, they prefer to buy pharmaceutical grade. Because with compounding, I think we're going off our aesthetic subject.
Yes, it's okay, but it's interesting because it's something that has never been spoken about before.
Yeah.
And it's just coming into its fruition now, where there's so many people talking about hormones.
Yeah.
And I think it's very related as we get older to keep us as fit and healthy and youthful as possible.
True.
So I think it's all tight. You can't do one thing without the other.
Yeah.
I mean, this is under the heading of anti-aging, right?
But many countries do not allow compounding.
That's correct, yeah.
Because we don't know the quality. Everything is happening in that pharmacy.
Yeah.
Where is the quality control?
Yes.
Actually, just yesterday, I was on the phone to one of the compounding pharmacies for personal reasons, because when I received my hormone, I felt it wasn't the same. I asked him, do you have external quality control? He said, hesitantly, it's done once a year. Excuse me, once a year? Quality control, external quality control. So it makes you very uneasy unless this is the problem.
But this is the problem that the person on the street doesn't understand.
Yeah.
They have no idea.
Yeah.
And, a doctor's word is gospel. Nobody ever questions your doctor, right?
Yeah.
I believe that we have 2 compounding pharmacies.
Yes, we do. Yes. Yeah. So, but I believe a lot of doctors are availing of, let's skip this subject because I don't want to talk about the compounding.
Yeah. What if somebody can't afford it because it is quite expensive?
Yes.
What could be an alternative for them?
As I said, there are pharmaceutical, let's say, I don't know how much is compounded estrogen. You're using compounded?
Yes.
How much do you pay a month?
Well, I get mine from Europe.
Yeah, you see?
It's a lot cheaper in Europe. But I mean, here, if I was to I have estrogen, progesterone, testosterone, it would be about 2,000 a month.
Right. Estradiol, which you can buy, pharmaceutical grade, is $20 for like 1.5 months supply.
Wow.
Progesterone is natural progesterone, again, pharmaceutical, is peanuts, like 30-40 dirham for 1 month supply. Of course you can.
I was using, I couldn't get my progesterone, and I used...
Progestin. Yes, it's progesterone.
And that's half, apparently, I believe.
No, it's progesterone, pure, natural progesterone.
Oh, okay.
Yeah.
And that was very
milligram
cheap.
or 200 milligram.
Yeah, the 200 milligram, I think, was 50 dirhams or something.
Nothing. So you can, and at least that is estradiol and that is progesterone.
So if you were to go into the pharmacy, what do you ask for exactly?
You would ask for, you can't buy it. They will not, it's
so
on
it's prescribed.
Yes.
Okay.
Yeah, it's
Right,
prescribed.
got
Yeah.
it. If someone was to go on the GLP-1, I guess the best thing for them to do was to do everything together. They look at their diet, they look at their exercise, they start their treatments in the clinic.
True.
What would you suggest they do
So
first?
the first thing is to treat the skin. Okay, let's say we're talking mainly, let's say the face and neck. So we would immediately start on the PLLA, on Sculptra. We would institute a course of Sculptra because it has to be done basically ballpark, one session or one vial of Sculptra. We calculate according to 10 years of a patient's life normally. That's a normal patient because that's our indicator as to how they would respond. You know, age is how we respond to things, how we heal slower the older we are. Okay. So let's say if a patient is 40 or 50, we would calculate 5 sessions once every 6 to 8 weeks. So gradual improvement in skin firmness, quality. At the same time, we would add an energy-based device. Okay, that's very, very important. There's a lot of evidence at a histological level, looking at skin slides, at what these devices do. We have solid evidence. Some of them literally thicken the skin, restore, rejuvenate skin at a histological level. It's not just what you see.
And what would be the name of that laser so that
We have a
Okay.
multitude. So it depends. Let's
You
say
do.
if a patient has a lot of deep wrinkles or a lot of, or acne scars as well, the extent of laxity, we would use a resurfacing laser. This could be from a very mild superficial laser just to give glow and radiance, because again, part of the issue with weight loss is lackluster skin. There's dull skin, loss of hydration, loss of glow. So we would do that. So from a resurfacing or a very powerful resurfacing, like a CO2 laser. You've heard of the fractional CO2 laser, erbium-YAG lasers.
Is there downtime with these two?
Typically, yes. The mild ones, 2 or 3 days. The more drastic ones, you could have up to a week of downtime. At the same time, so we would start off with something, let's say have a regimen of 2 or 3 or 4 a year, depending on the case, interspaced with regular monthly broadband light treatments. So the broadband light, this is a trademark name for one of the intense pulse light devices on the market, for which all the studies have shown with that particular device that it literally changes gene expression.
Amazing.
So they've done studies on women over 70 whereby they've occluded part of their forearm and treated only half of the forearm. What they've shown is that not only the treated part, every woman was her own control, if you know what I mean, treated, untreated. So the treated skin not only looked clinically better, there was less pigment, the skin was smoother, but biopsies again showed dense collagen and elastin, and they looked at the Stanford University Human Genomics Lab looked at gene expression in the 2 samples of skin, treated and untreated. They found that the treated skin behaved at the genetic level like a 30-year-old skin. The untreated skin behaved like 70-year-old skin in the volunteer. So this is one of the very few things we have really hardcore evidence that it rejuvenates skin at a genetic level.
And there's absolutely no downtime
Zero
with
downtime.
that. Yeah, I always loved that treatment on my skin. I could really
Yeah.
tell.
Yeah.
And people would always comment, "Oh, you're glowing.
Glow.
What have
Yeah.
you done?" You know.
Yeah.
And I think it's very underrated.
Yeah. So
that
sometimes you'll be surprised that even though they're losing volume, of course, if they have lost, one of the first places where patients lose volume is in the infraorbital area.
Yes.
And they develop what is called an eyelid cheek junction. There is like a hollow. And by the way, this can happen in the late 20s, even in a non-weight loss patient. It's one of
Yes.
the first areas to show deflation. So, of course, with weight loss, that's exacerbated. So what we do, we have to use fillers there. You know, PLLA will not work. So for certain areas, we use fillers.
Now, that's a bit tricky, I believe. fillers under the eye?
That's tricky for people who don't know how to do it. I'm sorry
Okay.
I have to say this, but
Okay.
that is the honest truth.
But that's what I mean.
Yes.
You have to know
You have
what
to
you're
know.
doing.
Because I can tell you in our practice, me and my colleagues, daily, we need to melt people who've been injected wrongly under the eyes.
Yeah.
Luckily, we can melt.
Yeah.
But when it's done properly, when the filler is injected very deep on the bone, you don't see anything. The person looks like they've slept 24 hours, just rested and natural.
That's good that you've said that, because there's a lot of people now afraid to do filler, and it's getting a bit of a bad rap for under the eye because people are being injected in the wrong way, and then it's causing all kinds of problems.
That's true.
So it's good that you've clarified that.
Yeah, but it's necessary. You know, you've heard of the deep plane facelift, right?
Yes, of course.
The founder of the deep plane facelift was a plastic surgeon in the US. Actually, he was of Lebanese origin, called Dr. Sam Hamra. He's considered by other plastic surgeons as having been the god of deep plane facelift. He's the one who started it. So I once watched an interview with Dr. Sam Hamra. Of course, he's in his 80s. He doesn't practice any longer. And he said something which really to this day rings in my head. He said the hallmark of a youthful face is two things. One, absence of a lid cheek junction, and two, a high cheek mass. So let's say the balls of cheeks that they are creating with filler is wrong because our natural fat descends anyhow.
Yeah.
So it's compounded with the filler. So the filler placement is very important. Where it's placed. So on the zygomatic arch and to eradicate or smooth out this lid cheek junction.
And they say the temples are very...
Yes, hollowing out. This is one of the first places where I think 50% of volume loss is in the temples. But this is easy to correct with PLLA. Very easy. So you can focus on, let's say, areas, as I told you, of volume loss, temples, zygomatic arch, and accentuate them.
Neck.
Oh, very difficult. Neck is very difficult after a certain point. Prevention is always, or delaying aging of the neck through energy-based devices, through Sculptra for the neck or
You
PLLA.
can do Sculptra
Oh, yes,
on the
now
neck.
we're started to do, again, even more dilute than Sculptra.
You know, mesmerized me how a lot of women do not know how to put cream on the neck. They stop
Yeah.
at the face and they
It's
don't
true.
treat the neck.
True.
We have to understand that the neck ages faster than the face, as does the eyes. So whatever you do to your face, you do to your neck and your décolleté,
Décolletage.
because this is what really ages. So let's talk about the neck, because women are not sure how to treat the neck. The neck always, they say that 35% of the subconscious mind, when someone's looking at you, can determine your age through your neck.
True. It's true. Really, that much?
And you know, I mean, you did the
Profound
on my neck, and
Yeah.
I mean, that's a very expensive treatment.
Yeah.
And you did one session on my neck, and I did see quite the difference,
Yeah.
because it used to really bother me, because, you know, I've always kept my face, but the neck goes after a certain
But it's
age.
looking good, Katrina.
Yes,
It's looking
thank
very
you.
good.
So let's talk about the neck.
Yeah, basically,
Educate us
as
about
you
the neck.
mentioned, prevention. I mean, always, as people are not aware, you put sunscreen or creams on your face, you put on your neck, sunscreen on your neck, and energy-based devices. Energy-based devices are the key.
Energy-based, give us a name.
For example, you can use ablative systems. Okay, energy-based devices are broadly divided into two subsections. Those that literally remove part of the skin, known as ablative devices, they vaporize fractions of skin. So what's
And
happening?
they burn.
They burn, they
Okay.
remove, they vaporize.
Yes.
So that means you're losing part of your skin. In each session, let's say with the fractional devices, you would lose up to 30% of your skin. So your body has to make new skin, regenerate. And we have the non-ablative devices. Again, it's a whole spectrum of machines which don't literally remove skin or ablate skin, but just stimulate. They can coagulate parts of your skin deep, like cooking steak, like they will cook proteins in your skin, again, to get it to regenerate or resurface. Okay, so you need a program depending on the severity of the condition, if you want to correct, of both ablative and non-ablative, and injections like PLLA. You can do things like PRP. You can do exosomes if you believe in them.
PRP. I believe that, if you take the blood from a 50-year-old woman and put it back in the skin, you're putting back the blood of a 50-year-old woman.
True.
They say that it's better to have baby stem cells to inject rather than your own blood.
True, there is a whole thing now with, cord blood and all this, and stem cells from cord blood, but maybe from your own family, maybe from
Right.
your grandchildren or something, or from your daughter when she delivered. But
Do you think there's better things that you can do now than do PRP?
there is evidence for PRP.
Mm-hmm.
There is, for example, for exosomes, we don't have solid evidence. That's why the Food and Drug Administration has not approved exosomes in the US.
Really?
No.
Because exosomes are the big thing.
It's a buzzword. Yes, it's a word. But there are so many sources of exosomes, from roses, from cord blood, from all kind of, from fat cells. So
What's
which
the best
exosome?
source? Do we know what the best source
For
is?
sure, human source is better. But then again, where is the evidence? What are these packets of? They're waste, packets of waste material that your cells churn out. Where is the evidence that they're doing what people claim they're doing? That's my question. We have exosomes in our practice, but honestly, because there isn't solid evidence, I personally have never recommended it for anyone, unless somebody comes and insists, like I had a lady, she insists on doing it once a month. We do it because we want to satisfy the patient.
I mean, and it is very expensive.
It is also expensive, yes.
I did a course on myself, and my skin looked good.
Yeah.
But I think when you've got good skin initially, it's very difficult to tell that difference.
True.
And
is it better than anything else?
Yeah.
This is it. Do you have people done, let's say, split face study, exosome one side, PRP, or exosome or energy-based device, for which we have really hardcore evidence.
And there is so much. I mean, I know that you're the master of it. You owned the company that sold all the lasers. So I know that you absolutely know about this side of the business,
No. All these things like boosters and the hyaluronic boosters and all these, they're like the icing on the cake. But the cake is the devices, the machines.
Because we want to stimulate the collagen elastin
Deep.
fundamentally,
Yes, fundamentally,
right?
True.
What can I ask you now? Your face is looking amazing.
Oh, thank you.
Really, I see the difference since I last saw you.
Yeah.
What's your secret?
Continuous care, as and when I can. Again, things that have a downtime, difficult to put in with my lifestyle.
I mean, I remember when you had Aesthetica, every time I saw you, you were always peeling, trying this product, trying that product. I've always, being more in holistic therapy, I've been in the business over 25 years. I've always stipulated you start with home care. True. I remember when you first started, you brought Namu into the country. Every single client I had, they had to have the cleanser, toner, moisturizer, serum. They had to, because if they're spending money on professional products and they're not taking care of their skin at home, you're fighting one thing against the other.
It's true.
And I've always recommended professional products. I'm a bit of a snob when it comes to products. Forget about your Lancome or your Clinique. True. It's like, with professional products, you have the higher percentages of active ingredients, true. Right?
100%. We always tell the patient, one hand doesn't clap. What we do here, you have to reinforce at home.
Yeah.
I mean, forget all exactly the beauty products because, some of them, let's say, actually Estee Lauder was sued in the UK because they put on the label glycolic acid. At the time, glycolic acid was in its inception being very powerful in regenerating the skin. So they wanted to put glycolic acid. Of course, if glycolic acid is neutralized, it's an acid. If you neutralize it, it's nothing, it's salt. But they neutralize it because they don't want to have any irritation. It does cause irritation. If you have an
of
active
course.
which is effective, the patient will feel it. They'll feel a little bit of tingling, so they can come back and, bring back the product to the shop, to the store. So they were obliged to put it in there because they had it on the label, but they put an ineffective form of glycolic acid. Things like that. So when you have high percentages of actives, the skin may react. And that's why they have to be only given by professionals
Yes.
and with proper follow-up.
I say it time and time again, it's the vitamin C and vitamin A are probably
Yes.
two of the most important ingredients, right?
Vitamin C, vitamin A, retinoic acid.
Yes.
Retinols. The retinols, one of the first to have been proven to regenerate skin. There are if you think about it, very few actives that really have been proven.
Yeah.
So people that come up with trade names that are meaningless, where's the evidence? Which is, something I forgot to mention in terms of the face as well when we're treating weight loss patients. And they're losing they're losing volume in all layers of the face. We have skin, fat, the SMAS, which is the muscles of the face, and more fat and bone. We treat the muscles of the face as well with the M-face, which is muscle stimulation for the skin, for the muscles to build and bulk. And we have evidence, by the way, that it bulks the elevator muscles of the face. So similarly for the body, we have the M-Sculpt now, which is a new era in body contouring. The M-Sculpt is high intensity focused electromagnetic fields, which give you like 10,000 sit-ups in half an hour, for example, or equivalent thereof. So you can use it to build muscle of the abdominal muscles, the buttocks, the thighs, the arms, any area of the body.
Does it really work?
It does work. We follow up all our patients with 3D photography.
Yes, you do.
We don't use iPhone.
Yes.
Sorry, I don't want to sound.
Dr. Maria has a very, what's the word, technical way of checking you out. When you come in, you get pictures taken front, up, down, side, all around about. And it's very professional. So you can really see the before and afters that are done coming into Altaderma Clinic.
Yes. So we are accountable to our patients.
Yeah.
They are spending time, money. They have hope in us. We don't want to disappoint them. So we need to prove to them, let's say, that yes, your abdomen is flatter or your buttocks have lifted. And now we measure volume as well, by the way, or loss of volume, depending on the case. So with the 3D system, we have a software, we call it registers the before and after in exactly the same position and measures distance between certain areas. So you can see if a patient has lost weight, let's say, or lost volume in the abdomen, how many cc's they've lost even. It's not just qualitative, it's quantitative. If they built muscle, you can tell them how much. So we use that. We also, for example, let's say in body contouring in general, where you have excess volume in certain areas, depending on your genetics, how you deposit fat, we also inject enzymes. Now, this has been a game changer for us, by the way.
Okay.
So we can make a complete program, including we have ultrasound devices that literally bust or lyse the fat cell. We have injectables which are with natural endogenous, like lipase, the same as we have in our body. Lipase, which breaks down the triglycerides to free fatty acid and glycerol, mixed with other enzymes, collagenase and hyaluronidase, which help the lipase diffuse in the interstitial space and enter the adipocytes, the fat cell. And these actually decrease the volume of the fat cell. They don't break the fat cell. So we have different devices, some that literally break the fat cell, some that shrink the fat cell in terms of the injectables, and the muscle stimulation also with radio frequency, which tightens the skin and also works on the fat. So we have a whole holistic approach in treating areas of what we call localized adiposities, fat or cellulite for that matter.
So we're talking for the body treatment, you would have to come in, what, 2 or 3 times a week?
Yes, for the M Sculpt, EM Sculpt Neo, this is the device.
And this is the latest technology.
This is the latest technology, yes. You would have to come once a week for 6 sessions. And the studies have proven that after 4 sessions, all the initial studies done in the US were based on 4 weekly sessions. And patients were followed up with photography and so on 3 months later, and they showed positive results. So we actually offer 6 sessions, and we add other devices to our protocol, depending on what the patient needs.
Amazing.
So prior to the M Sculpt, we would do something else, depending on the case at hand, and then the M Sculpt. Then at times we would add the injectables in a separate session.
I mean, for somebody like me, I can't train any more than I do. I've got good muscle tone, but my skin is loose. I mean, I had liposuction on my inner thighs when I was 42. And as a result of that, I now have loose skin. And my skin looks like old lady skin. It's all I need to do is pull it like that and then it's perfect.
Yes.
I mean, can these machines fix that problem?
For again, depending on the extent of laxity. Many women have had to have surgery, especially post-bariatric surgery, and there's no other way.
Yeah.
Then you're left with the scars. And if the surgeon hasn't done a good job, I had one woman, she was sobbing like anything. It was the most horrendous scar I'd ever seen, ever, all the way down her thigh, inner thigh.
But I do believe there's lasers that can greatly reduce these scars.
They can. Yeah, we do that as well.
Yes, and I know you do that.
They do, but so that sometimes surgery is the only answer. Sometimes combination, again, we have injections which are mainly based on collagenase and hyaluronidase. So what they do, they're used to treat scars. They're used also to treat damaged skin, which aging skin is damaged skin.
Right.
So literally you're digesting that damaged skin for your body then to regenerate. It's a slow process, but it does work. So in some cases, we might start initially with trying to digest the damaged skin, let's say the inner thighs, for example. And then we would start with a course of our favorite PLLA to firm the skin.
Yes, so a lot of people don't know that you can actually use sculpture on the body.
Oh yeah, you can.
Like, so we're talking stomach, hips, thighs, abdomen,
hip dips.
The hip dips are a big thing.
Incredible results, yeah.
Right.
Long lasting, not like a filler.
I mean, yes, so this has become quite popular, the filler to make the butt bigger, rounder, but you need so much filler.
True.
I mean, for me, I would think, really, do I want that much synthetic product going into my body?
And then it doesn't last. You're sitting on it all the time. It breaks down. It never retains its natural, original shape. I mean, people are showing on social media before and after with these huge buttocks. Yes, and then what? How long? And it's typically very costly. Let's say with PLLA, you could build up, but what you achieve, you have for many years.
Amazing. And we're talking, I think it's around 4,000 dirhams for one treatment, correct?
Yes.
And I think that's across the board. In most of the clinics, they're charging that. And I think I would also like to point out, and I've said it time and time again, when something is cheaper, it's because they're usually cutting corners or using a cheaper product. So it's a false sense of saving, right?
Unfortunately, Katrina, just a few days ago, a lady came in and she said, they've injected booster in my face. But I feel my cheeks are hanging here. The apples of my cheek, they're bigger. When I smile, but it's just booster. I said, well, a booster is hyaluronic acid. We checked her out with ultrasound. They looked, there was something else, not only hyaluronic acid. So anyhow, we injected the hyaluronidase, which dissolves hyaluronic acid. From the injection point, suddenly there was blood coming out, some white material oozing out. We spent an hour, a full hour, squeezing her cheek. Horrendous. I'm going to actually put the video on social media. I got her approval. To tell people this is something they do. Apparently, the doctor a year previously had done something like with calcium, a hybrid filler, mixing hyaluronic acid with calcium and everything. And they're doing all kinds of things and injecting it in her face. A full hour squeezing white liquid coming out of her. And it was not, there was no infection. It wasn't an infection. Her filler had been done over a year ago. There was no redness, there was no swelling, there was no fever, nothing, wasn't an infection. So the problem is there is a parallel market here in our region. People are bringing fillers from all over. Some of them are fake. So probably even if I would look at a box of Juvederm, I would not be able to distinguish
the danger,
fake
yes,
from the real, except since we know we buy it from the company itself, we know it's the real thing. But other people are buying cheap products. They don't know where it's coming from. A lot of it from Turkey.
What advice can you give the general public as to how to know if you're getting the real thing or not? I know it's very difficult.
It's difficult, yeah. You have to go on trust. You have to go on...
So the thing is, go to a provider that you trust.
A provider that you trust.
Yeah.
There are many high-end clinics who know what they're doing, who work ethically. Ethics is extremely important. So I'm sure there are a lot of clinics that are very good, and there are a lot that are a little bit...
I don't think there's a lot of clinics in Dubai that are of your standard.
No, there are, Katrina.
I think there's maybe a handful. I mean, I think, and this is where it gets diluted. I think Dubai is completely overwhelmed with clinics and spas and, whatever. And I think we cannot stress that enough, that you have to choose your provider. You have to ask questions, and you have to at least ask to see where the filler is coming from. Let me see the box. Let me see you opening the box.
They should ask for the pamphlet inside the box and the sticker on there of filler. The filler typically box has stickers.
Good advice.
The stickers, yes, so that in case anything should happen, they have the barcode and the lot number and everything.
Do you
of
hear
what
that?
was injected.
This is great advice, because most people don't know that.
Yeah.
Fabulous.
Most people, patients, you ask them what was injected, they don't know.
Yeah.
So,
no, they just, people are too lax. It's like going to get your nails done.
It's true.
It's become too,
frivolous,
easy.
Yeah.
Everybody's getting it done. But anything that's being injected into your body is a risk.
Of course.
You don't know how your body's going to react. Okay, so to finish, what would be your top 3 things that you would do to stay young, fit, healthy, and vibrant?
Generally?
Yeah.
Definitely lifestyle, nutrition, exercise, I believe is the fountain of youth.
Yeah, for me, absolutely.
Definitely. And well thought out aesthetic treatments. And, bioidentical hormones.
Fabulous. Dr. Maria, thank you so much. This has been great and very informative.
Thank you.
I hope you've enjoyed this episode. It's December, so happy holidays, and we'll see you next year. Until then, stay young, stay healthy, and take care.
Thank you, Katrina.
Thank you.